Blue Cross and Blue Shield of Texas believes in honest conversations like the one you're about to see. For thoughtful insights related to healthcare policy, check out our Blue Promise podcast and videos. Learn more at standingwithtexas.com.
Welcome to Coronavirus in Texas, a virtual event series from the Texas Tribune. I'm Patrick Svitek, and I want to thank you all for tuning in. As with most of the state, the Tribune has temporarily paused our in-person live events, but we're moving the conversation online with this series of virtual interviews. I'm here today with Dallas County Judge Clay Jenkins, and we'll be discussing the effect that the current outbreak is having on the North Texas region and how his office has been handling the response. This conversation will go until about 8:45 this morning. Judge Jenkins and I will also be going over questions submitted by our readers throughout the conversation. First, we want to thank our sponsors for supporting today's conversation: Blue Cross and Blue Shield of Texas and Texas 2036. We also want to thank KERA and KXAN for their media support. Though donors and corporate sponsors underwrite our events, they play no role in determining the content, panelists, or line of questioning. Finally, if you want to keep tabs on the latest coronavirus news in Texas, subscribe to our evening newsletter for updates at trib.it/coronavirus. All right, let's get started. Judge Jenkins has served as Dallas County Judge since 2011. Prior to taking on the role of County Judge, Judge Jenkins has worked as an attorney as well as a small business owner. Judge, thanks for joining us this morning.
Great to be here.
First things first, I'd like to just get a broad overview from you of the situation in Dallas County. It was obviously one of the early hotspots in Texas, and it remains the county with the second highest number of cases. What is still giving you cause for concern at this point? What's giving you cause for optimism? Can you just kind of give us a big picture view of the situation in Dallas County at this point in time?
Sure. So on the cause for concern, I'll announce at least 10 deaths today at 10 o'clock when we do our count of new cases and deaths. And so, every one of those is a person with a family. So that gives concern. On a cause for optimism, what our medical modeling is showing from Medical City, UT Southwestern, and Baylor, all those models are showing that our safer at home model that was first instituted on March 22nd is bearing fruit. We're flattening the curve. So that's giving us cause for optimism and hope. But we're in the middle, we're not at the end. And so we just have to stay focused on the mission. And the mission for everyone is personal responsibility, make good choices. Don't let up now. That's basically my message.
I know it's kind of a moving target, but when you look at the models that you're referencing, can you see yet when the peak may be in Dallas County or when you'll be at the top of that curve?
Sure. Well, that's part of the good news. So I always use this to show people we were looking at this on March 22nd. The models are showing we're looking more at this now. And what's also happened is that peak day is moving back towards us, which means we can get our economy hopefully opened up faster. So in March 22nd, the peak day was end of May, and now they believe the peak will be at the end of April or the beginning of May. And so that's the best guess based on medical models. I would caution people to remember that novel means new. It's a new virus. We're looking at data from all over. And so the doctors are really making somewhat scientific, but mostly just sophisticated guesses as to when that peak will occur.
Yeah. You mentioned the economy. Definitely want to drill down on that in the moment. But first, just broadly, can you tell us what are the needs that your county still has from both, I guess, the state government and the federal government, and how are they meeting those needs or not meeting those needs at this point in the outbreak?
So, needs. We need more testing. Testing is what gives you visibility into what's going on. We're like second to last in Texas right now in testing. That is something that needs to come from the federal government to us. I put in a STAR request, and a STAR request is like a request for federal assistance through the governor's office, through TDM, then through the governor's office, then to the feds. So we put in a STAR request yesterday. Also had some good conversations with HHS in Washington about this. We worked over the weekend on a plan for UT Southwestern, our big hospital, our big University of Texas hospital here in Dallas. to be able to do 5,000 tests a day, and for Parkland to be able to do 1,600 tests a day. And these would be tests that would have a one-day turnaround. Now, Patrick, let me give you some visibility into what a difference that is. Right now, on the Parkland test sites, we have 2 drive-throughs, or actually 3 drive-through, 2 federally supported, 1 that is county supported. All in, we can do about 620 tests a day at those 3 places. So you're talking about 6,600 tests if we can get that done. What that requires is we need reagents from the federal government. We already have the machines at Parkland. We need reagents and kits for that machine. That's 1,600. We've got enough machines at UT Southwestern. We can do 1,440 a day with just the reagents and kits. And then at UT Southwestern, we need 3 machines. They're all laid out in my star request, so that's a big thing. Another need that we have that I think is finally getting worked on, I sent a star request up in March for food for the North Texas Food Bank. North Texas Food Bank covers 13 counties. And right now, Patrick, what we're seeing is 70% of the people that are going to the North Texas Food Bank for food are new. They've never been there before since the coronavirus. Okay, so in the last month, 70% of the people are new. That means if a food distribution center would have 300 families come into it, now it's got 1,000. Okay, so that gives you an idea of the scope of the food insecurity problem. Well, that's depleted our food bank. So I sent that star request in March saying, we need money for the food bank. Unfortunately, the federal law was such that they couldn't give us the money. So Tony Robinson at FEMA, Region 6, myself, and the region for California, I forget what region that is, all lobbied, and I believe they've changed the rules, so now hopefully we can get money for that. Real quickly, though, there's a way you can help with that. I've started Neighbor to Neighbor. It's a virtual food bank for the North Texas Food Bank, and you can go, you can go to @NTFB, where you can get all of these charities that we've started for business and people to help at dallascountycovid.org, and just click on the links. 2 big links there, the food bank, and then another thing that we're having trouble with the feds, or not trouble, but that we don't have enough of, is PPE, personal protective equipment. We also have a fund for that where people can give to that fund. It's also on that same website. But we basically just started creating our own. We started our own supply chain here in North Texas, turned the distillers into sanitizers. We turned the people that made T-shirts and dresses into PPE manufacturers. We're even trying to find ways to build our own ventilators. But that's a big need, getting that medical equipment. And there's several needs.
Right. On testing, we had a question from a reader, Kimberly W., and I think you addressed part of this. She wanted to know how widespread is testing, and I think you ran through some numbers there. She also wanted to know, can we use the same data to predict outcomes in other counties? So I know you're obviously very mindful of the broader region that Dallas County occupies. Is that testing, are you able to draw any conclusions or make predictions based on what's going on in Dallas County about what may be happening in the broader region?
Yeah, I think you can. Is it Kimberly?
Yes.
I think you can, Kimberly. What we've done is I brought in Peter Urbanowitz. Peter was chief of staff to Secretary Azar, who is the Secretary of Health and Human Services under President Trump, up until about 6 months ago. Peter is my special assistant over a unified health system response. So when we think about what a health system is, Baylor Scott and White here in North Texas has many, many hospitals. UT Southwestern hospitals, Methodist, Medical City, THR, which is Presbyterian here in Dallas, and the Harris hospitals over in Fort Worth. So we're pulling the data together from them, okay? And they're looking at least those 4 big counties, because there's enough of a sample in those 4 big counties. And then you can extrapolate that. So if you're in Ellis County or Hunt County, you can somewhat extrapolate that to see how you're doing there. And so we're doing that because it's a regional thing, Kimberly. It does us a little good to do well in one county if we have a huge reservoir of virus in the next county, because we're all moving around, living in one place, working in another. So yeah, we're all working together on that.
Thanks. You mentioned the economy earlier. We're expecting some kind of announcement this week from Governor Abbott about what he would characterize as reopening, or at least beginning the process of reopening the Texas economy. As a county judge, what's your hope for that response or that announcement? What would you like to see factored into that announcement? I know we're still waiting a lot of details, but if you could outline kind of what you would like to see in that announcement at this point, can you share with us?
Sure. So, what I think is important and what we're doing here in North Texas is we're pulling together business leaders, economists, leaders in the Federal Reserve, think tanks, worker groups, labor, and very, very importantly, public health. And we're looking at what does the science say, because we want to act to get the economy moving again, but not at the expense of having a second wave of cases. So if he says he's going to follow the science, he's going to listen to public health, but he wants to put together a team of business people because business people know how to get business moving again, then I think he is in alignment with where we are, and that's what I want to see is an aligned response led by public health and business to get the economy back when it's time to do that, which is as soon as we can, but not too soon. Because, Patrick, it would be devastating if we had that second wave. It's not only devastating because it prolongs the situation where we all have to go back in our house. It's devastating to consumer confidence, right? If right now you're thinking, hey, if I can just get through this, life will get back to normal. What if it gets back to normal for 3 weeks and you have to go back in your house? That is really devastating. That's the kind of thing that we want to avoid. And we can avoid if we all work together and follow the science.
We had a reader question from Lisa along these lines. And again, I know we don't have a lot of details yet about this Abbott announcement, but there's a lot of interest out there. She asked, if Governor Abbott decided to, quote, open up Texas, what power do the county judges and mayors have to still keep their residents safe?
Well, Lisa, you shouldn't worry about that, because just as you saw where Governor Abbott said religious services should be allowed in an order when he did safer at home, okay, his change from what we had done 2 weeks before was a change in religious services. But then he pointed out when he clarified, but in places of community spread, of significant community spread, like we had here in Dallas, he was following the CDC guidelines. Okay, so what he's done in following, in doing the bars, closing the bars, and then in doing the safer at home, is he's followed those CDC guidelines. Well, if you follow the CDC guidelines, then you leave us the space to do what we need to do in places with significant community spread. So if you had a situation where, for instance, and I don't think this would happen, Lisa, but if you had a situation where Governor Abbott said all the restaurants are going to be open on Friday, well, in any county, or for that matter, city, that said we want to do something different based on the signature of the disease in our county or city, then the county or city's rule would be the rule that their residents would be living with.
You mentioned your safer at home order multiple times throughout this conversation already. I want to go back to that a little bit. You were among the first, if not the first, big metropolitan area county judge to institute such an order. Can you tell us a little bit about what informed that decision? And I guess more importantly, what does the data tell us up to this point about how effective or not effective that decision was? And I think you mentioned this a little earlier, but I just want to drill down a little bit in terms of what the numbers show since you instituted that.
Sure. So the what informed the decision was science. Okay. And so I talked to, that decision was the third decision that we were actually the first in Texas to do. And it was similar to the other two, where we limited crowd size and then closed restaurants to all but drive-through and takeout. It was listening to doctors. And so in this case, you're listening to in my case, you're listening to the DFW Hospital Council, which is the governing body, the association of all the hospitals. the Public Health Authority, Dr. Philip Huang here in Dallas, as well as the Dallas County Medical Society, which is 8,400 doctors, but they have a leadership group, and so they're president. I didn't have any doctors telling me that it was not the right decision to save lives. There was no debate with them on whether or not that should happen. And so, and these were the same people that were lobbying others to do it as well. And so we acted on that. And, what we know now, when we look at what Medical Cities model first said, and now what you're seeing with the UT Southwestern, the Baylor, and also the Parkland Center for Clinical Innovation models, is they all show that the curve is flattening. And so the delta between where we would have been and then where we are, that space in between, can be measured in lives saved, and also in the speed in which we can get back to somewhat normal life, right? If you've got this going on, it's just that much longer before you can get things turned back on.
Yeah, you mentioned speaking to Chief Nim Kidd earlier. I think, at that period in this whole pandemic, at the state level, the governor was still leaving it up to county judges and officials. That was his kind of public position on it. Was that did you get a welcoming message from the state when you decided early on that you were going to act, before additional statewide action and institute this at the county level?
I'm trying to think. I don't remember what message I got from the state there on that. Certainly Nim is a Chief Kidd is a good friend and does a great job. But I can't recall what message I got.
Right. So that order is effective through April 30th, I believe. At this point, do you see a need to extend it, or is it too early to make that call?
Well, the science, it's maybe a little early, maybe by Tuesday when the court meets again, we'll have a feel for that. The science will dictate that. And also, as we get closer to the decision, it gets easier for the public to see what we're looking at, right? I'm living with this, 18 hours a day. Many people, thankfully, are not, as far as looking at flow charts and data and having phone calls with health experts. And so, as it gets closer, you can see it, right? So, for instance, if the date were to be expiring today, we're announcing 10 deaths. We're going to have a lot of people, a lot of new illnesses. And I don't know what that number is yet because the labs haven't reported. But I think it'd be pretty easy for people to figure out this isn't over if the decision were today. And I think, probably maybe by next Tuesday, it'll be something we can look at and extend some.
Yeah, we had a lot of reader questions about the order that you issued. I'll go through a few of them. You may address some things that you already talked about, but if you could just elaborate, that'd be great.
Sure.
This first question is from Charles W. He wants to know, what criteria and specific data set will you be using to end the restrictions? So what will be, I guess, informing the fate that you render on the order?
Sure. So there's a lot of what you're looking at, Charles, is in all likelihood you're easing these restrictions in tranches of business, right? So there are businesses. I'll give you some extreme examples. It'll probably be a while before we can have a venue where there's 20,000 people shoulder to shoulder in the venue. But there are other jobs that may be able to come back online faster. So what happens, Charles, is you working with business, working with industry, and working with science, you identify that first tranche of businesses, and then with the scientists and the worker groups, the worker safety groups, you look at safety for the people going back, and you put those folks back to work. And this is sometime in the future, as we get past the peak, right? And then what Patrick and I were talking about earlier with testing, you got to have a lot of testing around that, Charles, so you can see what's happening, right? You're going to see, when you see more movement, you're going to have that opportunity for a few more people to get sick, but you don't want to see a huge spike there. And then if you see what you want to see, that signature of a relatively, flat happening after you open up that first section, Then say 3 weeks later, you're ready to maybe open another section or another tranche. And that's how you get the economy moving again, we hope. And, we even if you do everything perfectly, the virus is unpredictable. So you could have that second spike in cases. But the goal is to do that in such a way that you don't have that, it stays relatively flat and we're able to get our economy moving again and get people back to their jobs.
I'll jump in there quickly just to elaborate on a point you made. You mentioned the testing capacity before you get the economy moving again, however we want to define that. The governor has said that that'll be a component of his announcement. Anyone can look at the numbers statewide and see that we're still testing a very tiny fraction of the statewide population, at least at the county level in Dallas County. Are you confident you can get to a place where you've built up enough testing capacity so that when you're given the go ahead to, again, quote, reopen the economy or get the economy going, that you'll have the right testing capacity, at least at the county level? What's your confidence level at this point in that?
We've done as much as we can do. I mean, we'll continue. I'll work on it more today, and people are working on it every day. But we've seized on every opportunity that we've had. We were off the Walgreens list. I found their CEO's phone number. I talked to their head of testing, got us put on there for that little bit of testing. Two things have to happen, Patrick, for me to be able to give you a yes on that. One is the feds need to fully fulfill the STAR request that helps UT Southwestern and Parkland become mega test centers like the University of Washington was for the Seattle outbreak. And two, Dr. Fauci and his team have to get on a lucky streak, if you will, and find that test that is fast, relatively accurate, and highly disseminated. Because even if we get everything I've asked for, Patrick, it's 6,600 more tests for 2.7 million people here in Dallas County, 7.6 million people in North Texas, right? And so if all of our hospital systems were to increase their testing by 1,000 tests a day, that'd be an extra 5,000 tests for 7.6 million people. We have to have a game changer on that. And
Got it.
We'll get there.
Right. We had another reader question on your order. Wanted to know how is the city enforcing the order? So I guess, just add on to that, what are the potential punishments for violating the order and how vigorously is the city enforcing it? So,
we have a whole lot of things going on. We can't be the 6-foot separation while jogging police, right? So we haven't needed that kind of nanny state deal because our residents have stepped up and taken this seriously and really been compliant. We've had a few knuckleheads that have left their businesses open even though they're clearly not on the list. We write them, cease and desist letters and they close, And we've had a few people that, have not done so well, but that's going to be true of like speeders on the highway, right? You're going to have a few people that go 100 miles an hour on the highway. The vast majority of people go the same speed. So the speed that our North Texans are going is they're following the science. They're making good choices. Very proud of our community.
Right. So most people or places, it sounds like, are coming into compliance once they get a warning or some kind of formal correspondence from the city.
Yeah, absolutely. I mean, knock on wood. I better knock on some while I say that. We haven't been sued by anyone or whatnot. I think a big part of that is at a time when it's livelihood versus lives, right? Who really wants to? I mean, you'll have people that want to leave their smoke shop open, even though the rule says they can't. But once they're warned, then they generally will close up because it's terrible publicity, right? I mean, the publicity that you would get saying, my business is more important than your health is it's just not good. It's not good for business, right?
Right. We mentioned earlier, you obviously acted swiftly with this order. You also made a reference earlier to the commissioner's court. There was a vote last week where they voted to limit some of your emergency powers, try to have more of a say before you make some of these decisions going forward. Can you just address that vote and I guess how you would respond to the criticism that you may be moving too unilaterally or too decisively in some of these situations?
Well, so on the vote, we were able to amend that so there was a unanimous vote. I voted for it. All these commissioners are elected. They are elected because they all they saw problems. They wanted to fix those problems. I like to work collaboratively. Emergencies don't necessarily lend themselves to a lot of discussion and briefings and collaboration, unfortunately. But I like to work collaboratively. And so what we came upon, they originally said they wanted to be involved in not have any new business regulations without the Commissioners Court voting. They heard from the Dallas Regional Chamber of Commerce at their meeting and the Dallas Citizens Council, which is a CEOs group of large companies here in Dallas, saying, no, you don't understand. We're working with the judge. We don't want that. We don't want it to slow down on worker safety and the things that we're doing. And so they changed it to getting 3 hours notice as we make changes to regulations. And for instance, since they did that, we've changed notice requirements for nursing homes to make sure that certain people were notified of things. We've changed the rules for Airbnb so they can't do short-term rentals to non-essential business employees during this. They're having a lot of parties and things, and probably 10 or 15 other order changes. None of them have any of the commissioners asked, even one commissioner asked for a hearing on. The other change is that as we move to whether or not we extend the order on April the 30th, they want to have a say in that. They want to hear from the doctors and help make the decision and take a vote on that. And so those things aren't things that inhibit me day to day in keeping you safe. They're just things that keep the commissioners informed and in the mix of what is going on, and I welcome those things.
I know you voted for those changes. You said anything in retrospect that you wish you could have done differently or you prefer to have done differently in terms of keeping the commissioners in the loop?
Well, I know, every day when you're in the situation that I'm in and you're making dozens and dozens of decisions every day, that with the benefit of hindsight, I'll be able to find several that I should have done differently. I don't have the luxury of contemplation right now because things are still coming at us really fast and the important decisions have to be made, all the time. And so, but we want to be collaborative. The situation that I was put in the beginning with the virus is, and it's not people, but the virus puts us in these situations. We were the first county in the state to move to restrict gatherings. And then, in order to be successful, I've got to push the other counties to do that. And so that's a very fast thing. And the Open Meetings Act doesn't allow me to call up the commissioners and tell them everything that's on my mind. And that, ruffles a little bit of not commissioner feathers, but particularly surrounding county feathers. And then we were the first ones to close the bars. And I was able to tell the mayors about that because they're not under the Open Meetings Act. But I couldn't tell, the commissioners, although their staff knew about it. And that ruffled a lot of feathers. I mean, almost, it was almost uniform that people didn't want me to do that. And then moving to safer at home, same thing. That ruffles, feathers. Not so much at the commissioners, but, the surrounding jurisdictions and a lot of the cities. And so, we're working, past that. But I made my peace early on this, that my job was not to come up with my middle ground plan. My job was to follow the science and then act decisively on that to implement policies that would keep you safe. So that's what I did. And, to the extent that people, I didn't intend to offend anyone in doing that.
Another issue that is before the commissioner's court is this matter of the pop-up temporary hospital at the Kay Bailey Hutchison Convention Center. There, a couple weeks ago, there was an exchange with you in the governor's office about this. I know that there was a vote yesterday to at least put on pause a contract related to it. Can you just give us an update on where that project is at and whether at this moment you see a need for Dallas County to have that pop-up hospital, given what you have with current hospital capacity?
Sure. So our current hospital capacity, we've got about 54% of our beds at our hospitals in use right now across the whole spectrum of reasons people are in beds, not just COVID. And so we have ample capacity today for more people to be placed in the hospital. That COVID step-down unit, that Kay Bailey Hutchison COVID step-down unit, was to take pressure off of the hospitals should they reach near capacity. Not, should they be reeling and having to turn people away without adequate care. But when they get to a certain threshold, then the hospitals would say they want to turn that on. I've asked the hospitals to give me, in the next, what would be now about 36 hours, give me in the military some definitive, as best as they can, definitive answer of when they think that would be needed, if they think that is still needed. Because as we see the curve flatten, we see the good news, along with the bad, right? The bad news, as I mentioned, 10 deaths at least that I'll report today. But we're also seeing that curve flatten. We've stayed at right around 100 for the last 9 days. Sometimes it'll be like, 70 and sometimes it's 110, but it averages out to about 100 cases for the last 9 days each day. And so with that, the hospitals will tell the tale. We need what assets we need that our healthcare heroes tell us that they need so that they can keep us all safe. We have to have the bed capacity and the ventilator capacity. If people, go to the hospital, they need, to have the care that they need. And so, it's not a very good answer, I suppose, for you today, but the hospitals will give us the answer and we'll act on that.
If the existing hospitals come back to you and say, we're good with what we have, what should Dallas County residents know in that case, I guess, about the fate of that pop-up hospital at the KBH Center?
Sure. So if they say they're good with what we have, then the hospital would likely go somewhere else, right? If they say, they need it, then we'll fight like heck to keep it. They say they don't know, then we'll go with the next thing.
Mm-hmm. Is there a timeline that the feds have put you guys on to make a final say on that hospital, or is it a matter of it's going to be there for you if you need it at any point? What's the message, I guess, you've gotten from the military and the federal officials involved in planning for it?
Sure. The military has been great. We had a talk Saturday night with them about some things that they needed and some things that we needed. And then, our teams met at 9 o'clock on Easter morning and worked on those things, even on that day. So they've been great. The military wants to be in the fight, right? And so they want to go where they're needed. We want to work with them, and we'll continue to do that. And hopefully I'll get more visibility when the hospitals send me something. Right.
I mentioned that exchange with the governor's office earlier. One of the things that came out of that, I think I remember watching your press conference and seeing some of your statements from the time. You said basically to the governor's office, you have my number, you can call me like Rick Perry called me. There was clearly a lack of communication, I think, at some point in that process. Now that that's a few weeks behind us or a couple of weeks behind us, has the communication improved at all, or you feel you're still in the same position with the governor's office when it comes to having an open line of communication or not having an open line of communication?
Well, I reached out and called. I got the number for the governor's chief of staff. And so I reached out to that person and had a good conversation with them. It's also the person who wrote the letter.
Right.
I had a good conversation with them. I just encourage them, I'd answer my phone 24/7, 7 days a week. And, we talked about some issues that I still felt the state needed to do something different on. And it was a good conversation. And so, in that way, I suppose that's improved.
Sure. We had a reader question kind of tangentially related to this, but I'll thread it in here because I know, at least initially, Eric Johnson, Dallas's mayor, had expressed the same kind of concern that the governor's office had over the KBH Center. The reader question is, during this crisis, how is your relationship with Mayor Johnson? What is the city's role versus the county's role in handling the pandemic?
So my relationship is good, and the city has been doing a great job. Give me some examples of the great work the city is doing. So at our two pop-up test centers, the drive-throughs at the AAC and the Ellis Davis Fieldhouse, the city, it's actually a city employee that's the incident commander of those two things. Now it's staffed by Parkland or county nurses and doctors, but as far as the traffic flow and incident command, that's our partners, the city of Dallas. You go to that federally supported medical facility at KBH, incident commander, the incident commander there may be not, it's not a city person, but Rocky Vaz, the Office of Emergency Management leader for the city of Dallas, who does a fantastic job, is really leading a ton of that over there. The city of Dallas has taken a huge role in that. And several other things as well. Enforcement, you mentioned the orders, enforcement of that. Working on making sure the parks are not too overcrowded. So they're doing a great job, and it's good relationship born on the fact that we've been through this before, right? We've been through floods and tornadoes and shootings, the police shooting at the protest, Ebola, West Nile virus. We've been through all these things. We know each other. We like each other, and so that helps it work.
Right. We've got less than 10 minutes left here. We just got some leftover reader questions, and one of them relates to something you just mentioned. You mentioned Ebola and West Nile. We had a question from Elizabeth R. She wanted to know, what are some of the lessons that Dallas County learned from Ebola and other infectious diseases that have been useful in responding to this current crisis?
Elizabeth, it's a lot of the same stuff, right? It's treating other people the way that you want to be treated. That's a key tenet in life, and certainly in any emergency situation, because people rarely make their best decision when they're angry or afraid, or feeling disrespected. And so it's doing that, and it's a lot of those lessons learned from Ebola that help us to act, in effective ways in the next crisis. Just as West Nile virus, the response to West Nile virus informed Ebola, both of those inform this. And like I said a minute ago, it helps when people aren't just meeting one another, at an emergency, right? When they've been through it before, they know each other, they know each other's capabilities, strengths and weaknesses, and they trust one another. And there's a lot of trust between me and my team, and for instance, the city's team, NIM Kid and the state's team. A lot of these folks, we've worked well together before, so we have confidence that we can work well and keep people safe in this instance.
One other reader question we had is from April A. She wanted to know, how is the county providing relief for those who are living paycheck to paycheck and can't afford to pay anything now? So I guess she's curious about the role that the county could or is playing in providing economic relief amid this crisis. So,
great question. It's April. Is that what
yes. Yep.
April? Great question, April. The county government is somewhat limited in what they can do, but we're trying to look for ways where they can do more. So what we're doing now is this is a state function, but we're offering to help speed up and put some of our own people on unemployment claims. We're looking at getting information to people about how they can, access their federal benefits. We partnered with the grocery stores and big box stores to allow for free check cashing here in Dallas County at all the big box stores that normally wouldn't cash, checks for people that are unbanked and they have certain restrictions that they're waiving now. We've put into place bumpers on high risk or high loans. For instance, in Dallas County, payday lenders are not open, but pawn shops and check cashing services are, but they're limited to charging no more than 15% per annum. And for instance, at a pawn shop, they can't sell your stuff until 120 days after the last emergency order has been lifted. So those are ways that we help people. I'm putting together a tax plan so that hopefully we'll be able to have people who don't have their taxes paid within their mortgage to be able to pay those in installments. And by the way, if you're over 65 years old, you should contact dallascounty.org. We can already do that for you. And there's 100,000 people in Dallas County who are not taking advantage of that installment plan. We've worked with the utility companies to make sure people's utilities are not cut off. We put a moratorium on evictions through May the 18th that we'll probably have to extend. We've worked with extended stay hotels so people don't lose their places there, and several other things that I'm probably going to miss from just going on top of my head. But what we can't do, April, unfortunately, is we're not the federal government. We don't have that ability to kind of print money, and a county government has to balance their budget. We don't ever run a deficit. We have to balance it each year. So we don't have that extra, $100 million or $1 billion that we can, give grants out or loans out. But we're looking at different ways to continue to help. And I realize that with all we're doing, it's not nearly enough for the pain that you and so many of our residents are feeling.
In just the last few minutes we have here, one final reader question, and I think this is a good way to wrap it up. It's from Felicity P. She wants to know, what kind of outreach are you doing to ensure county residents understand what's going on? So where should residents be going to get the latest information, and what else should they know about what you're doing to give them the latest information?
Sure. So at Judge Clay J is my Twitter handle. And actually, we put out the information on there that all the reporters get it. You're getting it first at Judge Clay J. You can look on my Facebook page, which is, I think, Dallas County Judge Clay Lewis Jenkins. We have a lot of information there. You can go to our one-stop shop web site, which is dallascountycovid.org. You can get information there. And then we have people constantly communicating with the media in both English and Spanish. One of the reasons that I'm spending an hour here today with you and answering your questions is we want to be accessible and transparent. A big part of leadership in crisis is getting people to follow, right? If I just come up with a bunch of rules, Felicity, and just hope that people follow them, that's not really effective leadership, right? But by being accessible, answering these questions, leading through encouragement, not so much leading through fear or turning it into some sort of a police state or something. That's really the best way for us to get through this together.
Well, thank you very much, Judge Jenkins, for joining us, and thank you to everyone for tuning in. And also thank you to everyone who has supported today's event. To keep tabs on the latest coronavirus news in Texas, subscribe to our evening newsletter at trib.it/coronavirus. And have a good rest of the morning, everyone. And thanks again for tuning in.
Thank you.